Thank you. Good morning. My name is Evelyn. Our study purpose was to examine the association between geolocated social determinants of health and physical function among older adults, people living with HIV. For that, we conducted a cross-sectional analysis using baseline data from the health study with 120 participants from Colorado and Washington. Using participants' residential addresses, we link a range of geospatial indicators, including the Area Deprivation Index, Social Vulnerability Index, Mobility Infrastructure, environmental amenities, environmental hazards, and access to HIV care, with measures of physical function including 100-meter walk time, chair rise time, daily step count, PROMIS, function score, and frailty, and we conducted some correlation coefficients, specifically Spearman's, to assess these associations. In Colorado, we found that higher ADI was associated with a slower chair rise time. In Washington, higher SBI was associated with a slower 400-meter walk times, and greater distance to park was more common among pre-frail and frail participants. When we combined both cohorts, both study sites, we found that pre-frail and frail participants live in neighborhoods with higher social vulnerability. As a conclusion, higher deprivation, also greater social vulnerability, and longer distances to park were linked to poorer physical outcomes, and the patterns were different by study site. These outcomes underscore the need for larger studies and also place-based interventions to reduce disparities and also support healthy aging in these communities. Thank you so much, and also to my research team.
Yeah.